Our first case is of a married dog, female 5 year. Owner is worrying about his abdomen swelling because female is doing some vaginal discharge and vaginal leaking and history of polyuria and polydipsia. So doctor referred to us for ultrasound of uterus and ovaries because as per his history, maximum chances of pyometra, maybe open pyometra, closed pyometra, some endometritis or some reproductive abnormalities. As always, we do physical checkup before going to some big diagnostic like X-ray and ultrasound. In this, we do physical examination. Physical examination. What are the main clinical findings? Nearby to the stomach and liver, there is some film or solitary mass. Spleen appear normal, urine bladder normal, and the area of uterus and ovaries are also normal. So we proceed for X-ray. In X-ray, our main findings are stomach is coldly displaced, liver margins are not clear, and spleen area is normal. And in ovaries, no big growth. Kidneys are also normal, and in urine bladder area, things are not clear because haziness is there due to some fluid leakage in the abdomen. So now case things are become some complicated because first we see only abdomen enlargement. Now in X-ray we see some haziness, some fluid leakage in the abdomen. So these things are not good. So we want final diagnosis by ultrasound. So we proceed for ultrasound. In ultrasound, we start from the liver. In the liver, from middle lobe of the liver, we find is hypoechoic rim, hyperechoic mass, hypoechoic rim with hyperechoic mass. These are masses, solitary masses in the left lateral and middle lobe. These findings most probable of the hepatocellular carcinoma. In hepatocellular carcinoma, findings remain solitary. Chances of less malignancy, but these are fragile. So we request during physical examination we could not do some forceful palpation of the abdomen because sometimes these masses rupture or low bleeding. So our first differential from ultrasound we take hepatocellular carcinoma. Then we proceed further toward another lobe of liver. We check gallbladder. Gallbladder is normal. In the caudate lobe, caudate process, we find a pedunculated mass. In this pedunculated mass, there is some effusions are there, some leakage of fluid is there. These are maximum chances of hepatocellular adenoma because in hepatocellular adenoma, their pedunculated mass, leakage of mass is there. Due to leakage, seeding and malignancy chances are increased. Check malignancy, we proceed to the lymph nodes. In lymph nodes, we check mid-iliac lymph nodes, jejunal lymph nodes, gastric and splenic nearby lymph nodes. These are normal. Left adrenal gland dimensions are 4.6 mm, less than 7 mm. We consider it normal as per body weight. This is medium breed dog. Weight is around 15 to 20 kg. And right adrenal is also normal. And the left pancreatic lobe is also hypoechoic and normal findings. So we don't explain more about this organ. Then we proceed toward ovaries. In ovaries, left ovary is normal, but in the right ovary, things are changing. We find some hypoechoic cavitary lesions. So when after conclusion of this ultrasound, we make a differential list. In that differential list, we consider right ovary for biopsy. We take sample of that organ also. Rather than malignancy like adenoma and hepatocellular carcinoma, we consider hepatocytes nodular hyperplasia because in this also liver appear big nodular masses, sometimes solitary masses, some generalized hypertrophied masses are there. So in that cases, always we request owner that avoid long run, step up down, jump from bed because these masses sometimes ruptured, and if organ got ruptured and due to malignancy, maximum chances of seeding of that malignant tumors to the whole abdomen. So we take biopsy sample of that case, and in the after days when biopsy report come, then we further explain about that case.